Hello, I'm Robert, fact checker and science blog, and welcome to my channel where I'm helping people who are scared of many things. In this video I will try to speak in shorter, clearer sentences like I do when I'm writing to help autistic people, so I won't be waffling so much as in my previous videos. And this is the idea is that we all can work together to help those around us to be more careful about COVID and to share the message that the pandemic is not over. Indeed, for young people, the pandemic right now we've got more cases per day coming up in July than we have ever had. Your risk as a young person is higher than it has ever been in this pandemic. The biggest risk for young people is that 8% risk amongst children, 15% risk amongst young adults of long COVID. And long COVID means being really, really sick. You've never been sick like that before in your life, probably, for 3 months. For some have been sick like that for 15 months, just not feeling, not mind fuzzy, very tired, just on and on and on, it never seems to end. There are many people who have long COVID right now. 2 million people in the United Kingdom have had it during the pandemic. It's hundreds of thousands that are experiencing long COVID right now. Dr. Rachel Clark, is a palliative care doctor, and she is calling on the UK government to delay the July 19 lifting all restrictions until most are vaccinated. She is one of the many signatories of a letter by scientists and by medical experts, medical workers. She is a paediatric palliative care doctor. That means she cares for people who are dying, and she was called in to help people who are dying of COVID in the first wave, and she's been doing that all the way through the pandemic. So she's at the front line. She sees what's going on. She has written a book about her experiences of helping these people who are dying, who are not getting enough oxygen and so on. So this is the video, you can listen to it. I'm going to read out my short summary. So she says, I want life to go back to normal, we all do. This is not her actual words, but me shortening it. But we can't just make COVID go away. We're 10 days away from the government lifting all restrictions and allowing COVID to run through society. No masks, no social distancing, no restrictions on the numbers who are gathering. Already cases are hurtling skywards and the doubling every 9 days. Hospitals are already receiving COVID patients, up 40% in the last week. Every patient with COVID in the hospital is a patient without COVID that we can't treat. Example, Leeds Royal Infirmary had to cancel some major cancer operations and delay cancer operations and life and death surgeries. The intensive care beds there those cancer patients need are filled with COVID patients. So what does the letter to the UK government say? First, slow down. Wait until more people are vaccinated. Present, only half the population has 2 vaccines. So now I'm going to talk about what the letter actually says. The interview breaks off. We didn't have enough time anyway. So the letter says the outbreak will only slow down through immunity. Not enough people are vaccinated to slow it down, even though vaccine-induced immunity. So if we open up now, we slow down through natural immunity, mainly through unvaccinated young people. Health Secretary says cases could reach 100,000 a day over the summer months. The link between infections and deaths might be weakened, but it's not broken. Infection can also cause acute and long-term illness. And then they talk about their 5 main concerns. First, the effect on young people. It will affect the young most of all, and they've already been affected more than most people by the pandemic. Even assuming 20% of the rest have some protection from a previous infection, 50% fully, 6% partially, at least 17 million people with zero protection against COVID. The next potential growth will probably continue until millions of people are infected. If you look at epi curves, they go like that. Can you see my mouse? No, I don't think you can. It does if you look at an epi curve, then it has this kind of peak. It goes up to a peak and then it goes down again. And it only starts going down when about half the people who are unvaccinated, who are eventually going to get it, are infected. So you've got your 17 million. If it's eventually going to infect, say, 14 million, then it'll go up and up until there's 7 million infected. Then it'll go down and down until all 14 million have been infected. And this will leave hundreds of thousands of people with long-term illness, with disability. And we're risking a generation with chronic health problems because they don't know the long-term effects of COVID. You've got people who've been sick from COVID for 15 months, for the entire duration of the pandemic. We don't know how long that will continue for. Could be that some young people will still be affected by it right through to adulthood, maybe even until they're old people. This risks a generation with chronic health problems and disability and the personal and economic effects continuing for decades. And then there's concern too, a significant educational disruption. Allowing transmission over the summer will create a reservoir of infection which will probably accelerate spread in the autumn in the schools. In other words, everyone goes off for their holidays on summer, they come back, they bring it back from all the holiday destinations. All the kids many of the kids will have got these holiday infections of COVID, and then they return to schools and it spreads amongst all the kids who haven't got it yet. And disruption comes to sickness, not the isolation. And concern 3, and this is a very big concern, it turns UK into a breeding ground for vaccine-resistant variants. This would put all at risk, not just in the UK, but globally. So if the UK breeds, so this is perfect breeding conditions to have 40% fully vaccinated, 50% vaccinated, and then have the virus spreading through that. And the spread of more transmissible new variants will have worse effects on the most disadvantaged and in other countries with less access to vaccines. Then concern 4, impact on the health services. And that's what she focused on in her interview. The significant impact on health services, exhausted healthcare staff that have not yet recovered from previous waves, increasing hospital admissions will apply more pressure when people are already waiting for medical procedures and routine care. This is already happening. It's already happening right now, and it's going to get worse and worse until we stop it. And impacting most deprived qualities. So what is the answer? Well, the answer is to achieve immunity through vaccination rather than infection. Through mass vaccination, not mass infection, delayed just for a few weeks, until everyone, including adolescents, have been offered vaccination and uptake is high. And then for the younger kids, to wait until mitigation measures are in place, so adequate ventilation, that includes CO2 monitors in schools and air filtration devices, spacing, reducing class sizes. Until then, they say we need to do public measures called for by the WHO SAGE and independent SAGE, including universal mask wearing in the indoor spaces, even for those vaccinated, ventilation and air filtration, for instance at work and so on, effective border quarantine, so everyone who returns from other countries is quarantined against the variants. Test, trace, isolate and support. And that will ensure that everyone is protected, making it much less likely that we will need further restrictions or lockdowns in the autumn. I mean, if we have to bring it down from 100,000 cases a day with a new variant of concern, how long will that lockdown last with a more transmissible variant? The vaccines will help a lot, but if we need a booster shot as well to get down to everyone, that's going to take some months too. So I talk a bit more about vaccine evasion. I talked about that in my previous video. Dr. Sami saying this is This is exactly how she would structure an experiment to evolve a strain that leads to complete immune evasion. It wouldn't happen all at once. So a few amino acid changes, and then that one spreads, and then another slightly changed variant spreads, and then another one spreads, just creating conditions where there's a huge evolutionary advantage for small changes that erode the vaccine gradually, bit by bit. Again, if we see that happening significantly in the United Kingdom, we'd have to immediately start doing something about that. And this is another is Adam Finn, paediatrician and member of the Joint Committee on Vaccination and Immunisation in the UK. He makes that same warning. The variants that emerged last year spread because they were more transmissible. This year, and because they could infect more people. Now the UK has many more new people than any population where variants have emerged before. So the selection pressure is to evade that immunity. A large epidemic in a relatively highly immune population can lead to new variants that can escape that immunity. And this is Dr. Mike Ryan of the World Health Organization, and he just was very dismissive. But he doesn't think this is the logic of the scientists advising the UK government. But he says the logic of more people being infected is better has proved its moral emptiness and its epidemiological stupidity previously. Just said that, and then he just switched off his mic. Like a mic drop. Just, that's all I've got to say. He does say they're obviously trying to use vaccination to get some level of herd immunity. That's a totally laudable objective. So what these scientists are asking for, to vaccinate everyone, that is a very good way of achieving herd immunity. Then we can open up. So the idea of allowing people to be infected in order to achieve that, I think is something that the UK has made very clear in the past. It's not part of its core strategy in responding to COVID, and neither is this for any country I'm aware of at the moment. So I don't think this is the UK's strategy. But what we are doing, and these experts are saying in a letter that this is what's going to happen. That UK has made it clear it's not its core strategy to achieve immunity through infection. Well, if that is not your core strategy, then just don't. This is not the time to open up, because that's what's going to happen. We need to stop it going up to 100,000 cases a day. Don't need to just sort of say back, oh, we've got 100,000 cases a day, lots of people going to be infected, that'll help stop it. That is deeply unethical. And it's the politicians who say that, not the scientists. The logic of more people being infected is better has proven its moral emptiness and its epidemiological stupidity previously. That's all you have to say. So, and UK currently is in the top 3 COVID hotspots in Europe and 7 of the top 14. So now what the World Health Organization is saying, we need extreme caution. It's good to see deaths and hospitalizations fall in many countries with high vaccination levels. I wish we could achieve high levels of vaccination in all countries with increasing levels, but it's a good thing in the countries where it has been achieved, so it's good that we have achieved it in the UK. All the regions are seeing increasing cases, 33% in the European region, after falling for many weeks. It's now rising again. Transmission will increase because we don't have vaccines in everyone. We are still not sure how effective vaccines are at protecting against infection and onwards transmission. Increased transmission puts our most vulnerable at risk again. Many countries have not achieved levels of vaccination amongst their most vulnerable. And so these measures like wearing a mask are very simple, very effective, they reduce risk. It's all about your own personal risk management. So this is now, so we can share this with other people, try to get more awareness of what our government is doing. And on a personal level, then be aware of proximity. How close are you to other people? Density, how many people in the area? Is it inside? The duration. So for instance, in the underground transport, you have prolonged contact with many individuals in an enclosed indoor space. Obviously you're going to wear a mask in that situation. And try to persuade others to wear a mask. Just do what you can. If you can, avoid the underground. And you'll find other ways of getting to work. So Dr. Mike Ryan says individuals need to make their own decisions. People are smart. People have common sense. And it's very important now for individuals themselves to look at what's happening around them and know local numbers. So especially if you go and you can look at it's very easy to look at these maps now. Look at your part of the world, where you are, your region. For instance, if you're in the United States and you're in the state of Vermont, it's very controlled there. Cases are very low. Then it's not so important to protect yourself. If you're in Missouri and it's surging there, then it's far more important to protect yourself. In the United Kingdom, I know it's far more important to protect yourself if you're in a hotspot, like in Scotland where I am, if you're in Glasgow, say. If you're in the Outer Isles or the Orkneys or Shetland, then your risk is still, I don't think they've got much of an outbreak there at the moment, so risk is much less. So just be aware of where you are and what the risk is in your area. In where I am in Argyll and Bute, I'm in Isle of Mull. The risk here is very low, but I'm still being careful, so there's no harm in being more careful. You're stopping everything that goes through you. If it's in the community at all, then it's good to be careful. So it's a very dangerous assumption in the European environment that everyone is protected, it's kumbaya, and everything goes back to normal. This is not our situation. And he says a lot of gains have been won in the last number of months. Even high vaccination countries have suffered, the health systems have suffered. We need to think about what we truly value. We've worked so hard to get down from the January peak to just a few cases a day in April. Now it's just surging up again in the United Kingdom. We ask governments to be really careful at this moment and not lose the gains you've made. We ask you to open up very carefully. We've seen in the last 6 months, case after case, where there's a lot of increase, social mixing, wave after wave of cases. I hope we don't see a return to the overwhelmed hospitals, exhausted health workers. That is not a given. The virus is evolving and changing. We need to be very careful so the gains have been hard won by the behaviours and actions of our population are sustained. We need to be careful so we gain the health collective, the benefit collective of all that effort. It needs to be supported by individual behaviour, government support. So the World Health Organization urges extreme caution in the complete lifting of public health and social measures at this time, the consequences of lifting these measures. So do be very careful for the next few months. Right. I'll stop that. It's going to take me a bit of a hand to get into this. I think I'm still waffling too much. I'm going to try a shorter one. I'm going to just do another video with just that last bit from the World Health Organization. That's a very good summary by Mike Ryan.